May I just also for a moment bring the attention of both of you and our viewers onto this graphic that I'm putting out on the screens, which tells you the number of beds which are available in Delhi. Just for an example, if you take a look, the oxygen beds which were, for a couple of months, weeks back, it was very, very difficult to get an oxygen bed in Delhi. Right now, there are about 10,388 oxygen beds which are vacant. But if you look at the ICU beds, only 1,013 ICU beds are vacant. And if you take a look at the ventilator beds, it is only 197 ventilator beds which are available in Delhi. Dr. Shivdasani, I just wanted to put this out for a moment to understand the ventilator beds in the last few days as demand for the oxygen beds has come down. The ICU beds and the ventilator beds demand is still very high. Does this mean that the patients who are coming for medical treatment are possibly coming in late, and they are coming in serious conditions? That is why it is difficult to manage these patients and the deaths are high?
So I think in the second wave, what is happening, the presentation of the illness has changed. Initially, the first week was just, the disease typically lasts for about 2 weeks. And the first week is the viremia where, the virus replicates in the body. The second week is when the inflammation really happens. In this wave, we are seeing that the first wave has shortened and the inflammation is actually happening at the end of the first week at 4 days or 5 days instead of that 7-8 days. And by the time the patient actually presents himself or herself to hospital, it's a tad too late. And they are reaching at a point where they require not just oxygen, but, the ICU bed because the inflammatory markers have gone through the roof, the D-dimers have gone through the roof, IL-6 markers, and they are reaching a little later because we are testing probably at different times now.
Does this, Dr. Gupta, now require some sort of a different guideline? Initially, the assessment was that it is only after possibly 7th to 11th day when people were requiring hospitalization, or that was the danger period. Does it now need to be hasten up a little bit, possibly get patients admitted slightly earlier than we were doing in the first wave?
So, I think I would like to add to what the other doctor said. What is happening is a lot of people are coming in late. There is this thought in the mind of the person that, maybe I can treat myself at home and not go to the hospital at all because now I have the oxygen concentrator. What else are they going to do? And when these people crash, they want ICU beds. Right. So that is what I think is happening. The other thing that is happening is that there is a delay from our lockdown effect to what we are seeing right now. Right. So those people, the lockdown takes a little, we are lagging by 2 weeks in terms of the sheer illness. So we are seeing that those people who got infected 2 weeks ago or 15 days ago or 10 days ago, they are the ones who require ICU right now. I do agree that we are seeing a lot of people who are decompensating earlier than what was seen previously, around the 10th day, 11th day mark. But I think it's important that whoever is treating themselves at home, they be in a very close contact with a medical physician. They get themselves checked regularly. They share their vitals regularly. So at the first hint of getting sick or things not going as planned, or you rush to a hospital and get admitted.
Right.
So maybe with more aggressive treatment, we may be able to reduce the requirement for an ICU in that population.